Welcome back to Indus Special. We return to our discussion of COVID-19's impact. While some doctors are experimenting with hydroxychloroquine, the med is not FDA approved for COVID-19 treatment. There's no certified vaccine for it yet. Research is happening at breakneck speed. There are more than 20 vaccines in development. One has begun human trials after unusually skipping any animal research to test either the safety or the effectiveness of the vaccine. Other scientists are at the animal research stage and hope to get the results of human trials later in the year. There's also the issue of testing. South Korea's aggressive testing regime seems to have flattened the curve, but testing kits are scarce in most countries. To discuss this further, we are joined by Dr. Carole Lieberman, who's an analyst, psychiatrist, and a specialist in public health. We're also joined by Dr. Aisha Ihsani Majid, who's a radiologist and leads the Breast Cancer Screening Center at Pakistan Institute of Medical Sciences. Thank you so much for being with me. Let me begin with Dr. Lieberman. Dr. Lieberman, of course, this is a black swan event. No one was prepared for this. But give us a sense of where things are in terms of finding a cure, if at all.
Well, the problem is that all over the world, different authorities are recommending different things. For example, the question of whether we should quarantine or lock down or not. And if not, we would be trying for what's called herd immunity. But there are people all over trying to work with these. There are medications that are going to be tested. As you said, yes, typically there are more tests done before a medication is approved, but we don't have time with coronavirus. So
this is an extraordinary situation. So sometimes we'll have to skip animal trials, but then the issue is in terms of the safety and efficacy of the vaccine. I mean, what we are saying essentially is that we now have people as guinea pigs.
Yes, that's true. And there will be some people who have side effects and may even die because of some of these things. But the number of people who could be saved, I think, it makes it worth it to at least try these things, especially with some of the medications like the anti-malaria medications. They've been around for a very long time. Now, so we know that they're relatively safe. They haven't been tried before with coronavirus because coronavirus wasn't here before. But, we know at least that something about the medication. So I think it's worth it to be trying these things. The World Health Organization is going to be doing an experiment, essentially, yes, with all these different medications. And then eventually we'll be able to see which ones work best.
Okay, Dr. Majid, let's come to you and talk about the situation in Pakistan. Now, of course, we have resource constraints, we have various other issues in terms of what we can do to sort of, mitigate the economic impact of this on jobs and the rest of it. But ironically, right now, it seems, I'll repeat that, it may not be what it actually is on the ground, but it seems that the developed countries are not faring too well either. I mean, look at Italy, look at the United States. I mean, the US has now crossed, in terms of number of cases, crossed even China. So give me a sense of, given our resource constraints, what exactly are we doing here and what are we looking at?
Thank you very much, first of all, for calling me. As I'm working on ground, the main isolation in Islamabad is at the hospital I work in, PIMS, Pakistan Institute of Medical Sciences, and I'm the radiology in charge, part of the core committee of these patients, and we are following their x-rays, and we plan on the CT scans soon. So it's very simple. You see, that only two successful models in the world at the moment which have fought off this disease, and that's the Chinese model and the South Korean model. So it's very simple. We just need to follow one of these. The Chinese model is the draconian type, but maybe more suited to us, which is a complete lockdown. And the South Korean is a more humane model with the testing kits, which were made available initially. Even now they're producing 1 lakh testing kits a day, and there's 17 other governments who are in touch with them and buying the products. I mean, why can't we do that? That was like testing of the population and then surgical segregation of all who were in touch with the positive. We may not be at that point in our health system to do that South Korean model, though our numbers now aren't that much. We can still follow them. The US can't follow them. There's way beyond that. Italy can't follow them. That is done when there's initially cases detected. So I think that maybe the Chinese model for us with the large population and all that. But there is, at the moment...
Dr. Majid, let me interject. One, I think you put it beautifully in terms of the two models that can be followed. The Chinese model, which you rightly said is a draconian model, 13 cities, 60 million people under lockdown. But that model can also be implemented if you have the kind of efficiency and resources that China has. Now, the other one, the South Korean model that you talked about, which seems to me that we could perhaps emulate, but then there is the issue of how many trained people we have that we can send out in the field, whether we have the number of testing kits that would be required for aggressive testing, and so on. So give me a sense of where we are right now in terms of our testing capacity.
People come in for testing, just because of the paucity of kits, it's just certain number who already gotten infected. We know that they're positive, they're getting tested. If the 17 other countries in the world are buying those kits from South Korea, who are producing it commercially now, I mean, why can't we do simple things first?
So you're basically saying that in terms of making a choice between ventilators and testing kits, we should first be going for testing kits rather than for ventilators.
You know, why not start, treating and addressing the thing at ground level and then build up from there? And they can do both very easily, instead of just procuring equipment by equipment without any end user in the thing and just assuming you need thousands of so much and this, and
okay.
It's a waste of money.
Dr. Majid, stay with me. That's a very important point. Let me go back to Dr. Lieberman here. Dr. Lieberman, two models, the Chinese model, the South Korean model. And we just talked about Pakistan, our own resource constraints, our own perhaps policy failures. But it seems that the United States, which has probably the most capacity, the state's capacity in terms of coffers, but being what it is in terms of individual liberties and the rest of it, not being able to flatten the curve in the way that Chinese did. Give me your reading of the situation.
Well, in the United States, for all countries, the problem is that we don't really know. We don't really know the coronavirus. We don't really know how it works, and so in the United States, there are, according to where you live, different states, the governors have made different rules. Some of them have been more draconian than others. Like, for example, where I am in California, the governor of California and the mayor of Los Angeles have put into place stay-at-home orders, rather draconian. Not that everybody is listening to that, I will have to admit. But then it's because there's another way of looking at it, this herd immunity, as I mentioned, which is when you have enough of the population that has either been vaccinated or that has gotten the disease and has developed antibodies to it. And both of those things can make it harder for new people to get infected. So there's that, some places are doing that.
Dr. Lieberman, let me interject here. You're absolutely right. I mean, look at the 1918 Spanish influenza. Now, today, we get it all the time. And we okay for the most part. But to get to herd immunity, there's a certain cost in human lives that one has to pay. So the issue really is whether we are prepared to make that sacrifice, to actually pick up that cost.
Yes, and the problem is that we don't really know the numbers of people who would be lost one way or the other, and so we're having this sort of mix and match kind of way of going at it. When this pandemic is over, we will have some of the answers to this, but it's hard because there is the issue that you alluded to about liberty and taking away rights and so on, but then we don't want people to get sick, so. It's a very hard choice, and really we don't have enough information to make the choice in a very wise kind of way.
Well, before you joined me, I had Professor Keene on the program as an economist, and we were talking about precisely this issue in terms of the state capacity and the fact that, for so many decades, one of the things that we were trying to do was to keep the state away, not in terms of its capacity, but in terms of its ability to impose certain things on society. But it seems now in these extraordinary times of this pathogen that we actually hoping that the state has the capacity to effectively implement lockdowns and the rest of it. But thank you so much. That was Dr. Carole Lieberman speaking with us. Let me go back to Dr. Majid before I wrap up this segment. Dr. Majid, it seems that we are at this point groping in the dark. Now, that is something which is scarier than the pathogen itself.
Yes, very true. I totally agree with you. It's like too many cooks spoiling the broth. Everybody's coming up with their own innovative idea. It should be, as I said, I think maybe the Chinese model would suit us, but because we don't have the capacity or the acumen or the thing for the mass testing and then surgical segregation. So let's have a national policy.
One more point, since I have to wrap up, for my viewers. There's a lot of, how WhatsApp works and WhatsApp groups work. There's so much, and it seems that everyone has some kind of solution for this. I mean, suddenly we all are doctors and, biologists and biotechnicians and the rest of it. Please tell the viewers if it is okay to look at WhatsApp and pick up recipes and remedies from WhatsApp groups.
I think all this social distancing has made people bored at home, and there's too much of this WhatsApp, and there's too much conversation and noise in the society. And I think just a national policy, which is implemented throughout, it may be most probably it'll need we need the state machinery, which means all machinery, and let's just do that, and then stop discussing and on WhatsApp and trying various medications and all these rumor mongering. This has created panic in the society.
It's creating panic. Thank you so much. That was Dr. Majid, Aisha Isani Majid speaking with us. This is all for tonight, and this week we shall see you next Thursday at the same time. Meanwhile, for latest updates, you can follow us on social media at indus.news.